Hi guys, welcome to this short session on the anatomy of the diaphragm. We'll try and cover everything important in under 5 minutes. But before we start about the diaphragm per se, it's important to know that when you're studying for the exams, you should study every muscle under 6 broad headings. They include, firstly, the attachments of the muscle, primarily the origin and the insertion site of the muscle. Then the parts of the muscle, especially when it's a large muscle, it's bound to have a few parts. So the parts of the muscle. Then a little bit about the nerve supply and the blood supply of the muscle. More importantly, the nerve supply of the muscle. And then also about the action or the function of the muscle. And lastly, some relevant clinical fact or some clinical relevance of the muscle. So whenever you approach a muscle, try to study it just under these 6 headings. So let's start up with the diaphragm. So the diaphragm is a dome-shaped skeletal muscle that separates the thoracic and the abdominal cavity. So it's a dome-shaped skeletal muscle that lies between the thoracic and the abdominal cavity. Most of you have already seen pictures of that. Now let's talk about diaphragm under those 6 headings. So firstly, the attachments of the diaphragm. So the diaphragm is anteriorly attached to the xiphoid process, laterally to the costal cartilages of the 7th to 10th ribs and also the 11th and 12th rib. Then posteriorly, the diaphragm is attached to the lumbar vertebrae and the arcuate ligaments. I'll show you all of that in the image in a while. Then let's talk about the parts of the diaphragm. So the diaphragm has a central tendinous portion, the muscular portion, and the crura of the diaphragm. Now I'll show you each of these in this diagram. So firstly, let's look at the attachments anteriorly to the xiphoid process, then to the 7th to 10th vertebrae, costal cartilages of the 7th to 10th vertebrae and the 11th and 12th vertebrae. Here 11th and 12th vertebrae, right? And to the spine or lumbar spine posteriorly, and these are the arcuate ligaments. Okay, I'll just clear the ink to show you once more. Yeah, so these are the arcuate ligaments. You have 2 arcuate ligaments, the lateral arcuate ligament. So arcuate means arc-like, so the lateral arcuate ligament and the medial arcuate ligament. Now we'll talk about the parts of the muscle. So I told you there's a central tendinous region. That's what I'm showing you. So it has a large central tendon. Then you have the rest of the muscular portion. And more importantly, you have the crura. Okay, crura are nothing but tendinous attachments which connect the diaphragm to the spine. So you have one crura on the right side called the right crus, and you have one crura on the left side called the left crus. Over and above this, the diaphragm has 3 major openings which are very high yield, and we'll talk about in good detail in the later half of this discussion. So far we've discussed the attachments and we've discussed about the parts of the diaphragm in a very brief manner. Now, before we move on, the left crus is attached to the L1, L2 level, maybe in between L1, L2, and the right crus is attached between the L1 to L3 level. So it's attached between the L1 to L3 level. So the right crus is slightly lower, again beautifully shown in the diagram. So you can just have a look at this diagram after and try to place whatever we discussed so far. Now we'll talk about the actions of the diaphragm. So the main function of the diaphragm is respiration. Okay, and remember the diaphragm is responsible for inspiration when it contracts. So this is a very important point. The key muscle for inspiration is the diaphragm. So inspiration occurs when the diaphragm contracts, and when the diaphragm contracts, it pushes this dome downwards and increases the volume in the thoracic cavity. Also decreases the pressure in the thoracic cavity. So it produces a negative pressure in the thoracic cavity when it contracts. So 3 things: it contracts. Firstly, it increases the volume of the thoracic cavity, and secondly, it reduces the pressure within the thoracic cavity. So it creates a negative pressure within the thoracic cavity. And expiration occurs when the diaphragm relaxes. Okay, expiration occurs when the diaphragm relaxes. So the main function of the diaphragm on contraction is inspiration. So if you remember function of diaphragm, inspiration, it's more than enough. Now let's talk about the nerve supply. The diaphragm is supplied by the phrenic nerves, the left and the right phrenic nerve on either side. So the diaphragm is supplied by the phrenic nerve, and the root value of the phrenic nerve is C3 to C5. So remember, these are very important roots, and any injury, especially at the C3 level, leads to respiratory distress and can even lead to death. And that's why high spinal injuries are so dangerous and so crucial. So high spinal injuries can occur and diaphragm can lose its function. So C3, C4 and C5 keep us alive. A small mnemonic to help you remember. Most of you would have used this mnemonic in first year. So diaphragm is innervated by phrenic nerve, which comes from C3, C4 and C5. So therefore C3, C4 and C5 keep us alive. Arterial supply supplied by the left and right phrenic artery, and the venous drainage is by the inferior phrenic nerves. Not so important, just the action and the nerve supply and especially the roots C3, C4, C5 are very important. Now let's go to the diaphragmatic openings, the most high yield topic from diaphragm. So the diaphragm has 3 major openings and 3 minor openings, and these openings are named based on the major structures that pass through them. So 3 major openings include the inferior vena cava opening at the level of T8, the esophageal opening at the level of T10, and the aortic opening at the level of T12. I'll show you in the diagram, so don't worry. So the IVC opening or the vena cava opening is located within the central tendon of the diaphragm, and the IVC and the right phrenic nerve pass through this opening. Next, you have the esophageal opening, which is located at the level of T10, and it's located within the muscular part of the diaphragm. And through this, the esophagus and both right and left vagus nerves pass. Lastly, the aortic opening, which is at the level of T12, they are formed between the crus of the diaphragm, or it is formed between the crus of the diaphragm, and through this you have the aorta, thoracic duct, azygous vein, and hemiazygous vein passing through. So you have the hemiazygous vein, aorta, and thoracic duct. So you can remember the mnemonic HAT, right? Now let's talk a little bit about the minor openings, and then we'll place the openings in the diagram. So among the 3 minor openings, you have the costo-xiphoid gap, the small gap between the xiphoid process, just below the xiphoid process rather, and through this gap you have the superior epigastric artery. This gap is also called the space of Larry. So remember, the superior epigastric artery passes through the space of Larry. Next, you have the medial arcuate ligament. I already showed you earlier in a diagram. This is the medial arcuate ligament, and through the gap here you have the sympathetic chain. So sympathetic chain passes through the medial arcuate ligament, and lastly the lateral arcuate ligament. Again, you have a small gap there through which the subcostal nerves and vessels pass through. Now let's place each of these openings. So firstly, the IVC opening, you can see it's in the central tendinous part of the diaphragm, okay, central tendinous part of the diaphragm, and through this the main structures that pass include the inferior vena cava, which goes from the abdomen through to the thorax, and also the right phrenic nerve. Next, you have the esophageal opening, which is completely located within the muscular part of the diaphragm, and through this you have the esophagus and the right and left vagus nerve, and lastly you have the aortic opening, okay, which lie between the right crus and the left crus, so lie between the crura of the diaphragm. So you have the aortic opening through which your HAAT pass through, which is aorta, hemiazygous vein, azygous vein, and the thoracic duct. So these openings are very, very important, very high yield. So if you want to remember just something or just one thing about the diaphragm, focus on learning about these hiatus of the diaphragm. Okay, the diaphragmatic openings are also called hiatus. So the hiatus, especially the major openings and the structures that pass through them. So that's it for today. We'll have another discussion tomorrow. See you guys.